Welcome to this week's medical moment at Marina Hills Animal Hospital. We have an interesting case to talk about today. The patient, we've decided, has sterile nodular panniculitis. Now, what the heck is that? The panniculus is a layer of fat that's under a dog or cat's skin. In dogs and cats, it's associated with a muscle. It happens to be called the cutaneous trunci, if you care. And when we touch them and you see their skin move, they're contracting their cutaneous trunci muscle, which is associated with this layer of fat below the skin. The term for the reflex is called the panniculus reflex, but it's sort of a misnomer because, well, who wants to say cutaneous trunci reflex? I don't know. Anyway, the panniculus is a layer of fat which sometimes becomes inflamed. The most common thing that triggers inflammation in this layer of fat cells is, wait for it, free fat, lipid. So lipid is supposed to be inside of fat cells, they're called lipocytes. If the lipid is released into the panniculus tissue, it causes inflammation. The body doesn't like it, it goes to war, and sometimes a small bit of inflammation can turn and cascade into big areas of firm, hard swellings that are just below the skin. Sometimes it's painful, and sometimes they progress to the point where they rupture through the skin and they drain. And pets have these big draining sores that all started with inflammation of the fat in the fat layer below their skin. Broadly speaking, inflammation of the panniculus can be caused by infectious agents, by trauma, by inflammatory agents, or sometimes we can't figure it out, and so that has its own class. For example, if skin gets pinched in trauma, closed in the door, hit by the car, that kind of thing, and fat is released, sometimes the inflammation will occur because the body doesn't like that free lipid underneath the skin. Another example would be infection by various agents, so a puncture wound that introduced bacteria under the skin can result in inflammation of the fat. There are some very exotic infectious agents that are known to do this. They're called mycobacteria. If you've heard of tuberculosis, very rare in dogs and cats, but if it happened, it might cause inflammation of the fat, panniculitis. Interestingly, panniculitis, inflammation of the fat, can be caused when pets have pancreatitis. The pancreas is inside the abdomen, making digestive enzymes. If a pet has very severe pancreatitis, the digestive enzymes can enter the bloodstream, end up in the fat layer under the skin, and cause inflammation of the panniculus. What's interesting is we look for all those interesting and various causes for panniculitis, but if we can't find them, then we're left with a diagnosis of sterile nodular panniculitis. And it turns out this is the most common cause. And essentially, this is a situation where the pet's own immune system is beating up their fat. So they're treated very differently. In the first case, we treat the infectious agent if we can find it, either with antibiotics or mycobacterial drugs. There is an infectious agent called Bartonella. You've heard of cat scratch fever. Bartonella is the infectious agent. That can sometimes cause a nodular panniculitis. But if we can't find the cause, we call it sterile nodular panniculitis, and the treatment is essentially to suppress the immune system. If the problem is that the immune system is overactive, then the treatment would be to suppress the immune system. There are various drugs available to suppress the immune system. Some of them are very safe with few side effects. For example, the combination of doxycycline with niacinamide is a very safe way to suppress an overactive immune system. Unfortunately, the patient that we have currently is responding really nicely to doxycycline with niacinamide. If that hadn't worked, we would have to go down the trail of significant immunosuppressive drugs. Things like prednisone, azathioprine, cyclosporin, all these drugs are sometimes needed to suppress the overactive immune system, causing inflammation of the fat. When there is an infectious agent, if you treat the primary disease, you've solved it. Sometimes when dogs have the sterile nodular panniculitis, it's a condition that they've then cared for the rest of their lives. And so some of those patients need to be on some amount of drug forever. you can see why it would be important to figure out the why before you started treating these patients, because if they happen to have an infectious disease, and instead of treating the infection, we just suppress their immune system, well, things are going to get worse, not better. So we have to take the time to do the cytology, to do the cultures, to do the testing that's needed to make sure there isn't an infectious agent, which we did in this case, which was pretty cool. So that's the report on nodular panniculitis and sterile nodular panniculitis coming to you from Marina Hills Animal Hospital, and that's our medical moment.